Welcome to the Explainer. Finding a breast lump can bring up a lot of questions and uncertainty. So today, we're going to break down the medical process for evaluating one. We're going to look at the structured, step-by-step approach doctors use to turn that uncertainty into clear answers.
Now, I know this process can feel pretty stressful, but it's so important to know that it's a highly reliable and structured one. So let's just walk through exactly how it all works. So here's our roadmap. We'll start with the one big question that really drives this whole investigation. Then we'll dive into something called the triple test, which covers the clinical assessment, imaging, and getting a sample, before we see how it all comes together to create a really clear picture.
Okay, so at the very heart of this entire process, it all boils down to one fundamental question. Is this lump benign, which just means harmless, or is it malignant, meaning it's cancerous? The main goal of every single test is to confidently answer that question.
So how do doctors even start looking for clues? Well, it often begins with your history. For instance, benign lumps tend to change with the menstrual cycle, and they might feel a little tender. On the flip side, malignant lumps usually grow steadily, and if there's any pain, it often feels more persistent and deep.
To solve this kind of medical mystery with a really high degree of accuracy, doctors don't just rely on one piece of information. Nope, they use this powerful three-part framework that's known as the triple test. And this process is so effective because it layers three different kinds of evidence. You've got the doctor's hands-on exam, you have advanced imaging to see what's going on inside, and then, finally, a direct sample of the tissue itself. Each step gives us a clearer piece of the puzzle.
The investigation always begins with the clinical assessment. This is where the doctor starts gathering those first critical clues, both through a detailed conversation with you and a physical examination.
Your answers to these questions are just incredibly valuable. For example, knowing if a lump changes with your cycle, or if there's any nipple discharge that happens on its own, really helps the doctor start narrowing down the possibilities right from the get-go.
Now, during the physical exam itself, one of the key things a doctor checks is mobility. Is the lump moving around freely, or does it feel kind of tethered or stuck to the skin or the muscle underneath? That fixation can sometimes suggest a more advanced issue.
The doctor will also take a really close look at the skin over the breast. They're looking for subtle signs, like any dimpling, which is sometimes called retraction, or any small nodules, or even little sores, because these can also be important signs of what's going on underneath.
And one very specific sign doctors are trained to look for is called Peau d'Orange. The name literally means orange peel skin, and that's exactly what it looks like. This appearance, which is caused by fluid buildup, is a pretty distinct visual clue that can point towards a potential malignancy. Another really distinct sign they look for is a rash on the nipple that looks a lot like eczema. This isn't just a simple skin irritation. It can actually be a sign of a very specific type of breast cancer known as Paget's disease.
Okay, let's move on to the second step and see how it builds on that initial exam. So after gathering all those clues from the outside, the next step is to use some powerful imaging tools to see what's happening on the inside.
The first imaging tool they'll often reach for is an ultrasound. It uses sound waves to create a picture, and it's fantastic at one key job: telling the difference between a simple, fluid-filled cyst and a solid mass.
And next up, we have mammography, which is really the cornerstone of breast imaging. It's a specialized X-ray, and it's used not just for routine screening, but also for getting a super detailed look at a specific lump or an area of concern.
So what happens when those tools aren't quite enough? What if a lump is just hard to see on a mammogram? Or maybe a person is considered very high risk and the doctors really need an even more detailed view. Well, that's when an MRI comes into play. It gives this incredibly sensitive and detailed picture. It's often used for screening in women who are at high risk or in more complex situations, like trying to find a hidden or occult tumor that just isn't showing up on other scans. The clinical exam and the imaging provide incredibly strong clues, but to get the final definitive answer, doctors need to analyze the tissue itself. And this is the third and final step of that triple test. Okay, there are two main ways to get a sample. A fine needle aspiration, or FNA, is quick. It just pulls out some loose cells. But a core needle biopsy is different. It takes out a small, solid piece of tissue. And that difference is absolutely critical because the core biopsy preserves the tissue's structure, its architecture. And that structure is what lets doctors see if abnormal cells are in situ, meaning contained, or invasive, meaning they've started to spread.
And for that exact reason, a core needle biopsy is the preferred method. It's the gold standard. That tissue architecture lets pathologists see not just what the cells are, but how they're arranged. And that arrangement is the key to knowing if something is contained or if it has begun to invade the surrounding tissue.
And here it is. This is the most important number to remember. When all three parts of the triple test, the clinical exam, the imaging, and the biopsy, when they all point to the same conclusion, the diagnostic accuracy is over 99%. It is an incredibly reliable process.
So, let's bring it all together. When you look at these three steps working together, you can really see why this investigative process is so methodical and just so effective.
The key takeaway here is that medicine approaches this problem not with guesswork, but with a clear, reliable, evidence-based process. Think of it like this. Each step provides a different piece of the puzzle, and when you put them all together, they provide the clarity that's needed to guide patient care and turn that fear of the unknown into empowered knowledge.
You see, knowing how this all works is meant to be empowering. It really highlights the importance of not waiting or worrying, but of seeking timely professional medical advice if you ever have a concern. Understanding the path forward is always the first step to navigating it.